Well, now I'll speak a little bit about behavioral approaches, which are very, very different from psychodynamic approaches to therapy. The behavioral treatment approach really builds on the basic principles of learning theories. Okay, we touched on this a little bit earlier in the course. As you'll see here, a lot of it involves operant conditioning principles from B.F. Skinner and others. And a big component of behavioral approaches to therapy as well is aversive conditioning, the pairing of pleasant and unpleasant stimuli to reduce the likelihood that the negative behavior occurs again. Negative in the sense of something the patient wants to stop. For example, and the classic example here, and one that works pretty well, at least in the short term, is alcoholism. Okay, so someone who's an alcoholic just can't stop drinking on a regular basis. This is a fairly extreme point that the therapist might reach in using aversive conditioning. They might try a few things first, and they probably should. But if it's really an extreme case, then they'll start pairing the alcohol. Literally, they'll have the patient drink their favorite alcoholic beverage or something. Okay, but right after they drink it, they will drink something very unpleasant. There's a chemical that can cause vomiting. Okay, and so basically the therapist is utilizing some different theoretical evidence from the behavioral research, such as the fact that if you pair something negative with something positive, well, it's gonna work as a form of punishment here, such that you're going to reduce the likelihood of the alcoholic behavior occurring in the future because you're associating something. I don't want to say negative because we've learned the difference between positive and negative conditioning is not the same thing as good and bad. So I'll just say bad. You're associating something bad with the behavior, namely making the person vomit, okay? And so that association should dissuade the alcoholic from drinking in the future, at least in the short term, and it tends to be very successful in the short term. Another aspect here is the Garcia effect, which I think we've covered before. The Garcia effect states that if you make yourself, or whether you're making yourself feel sick or if you just happen to feel sick shortly after eating something or consuming something, whether you're drinking or eating it, you're going to tend to associate that sickness with whatever you just ate or drank, and that will automatically create that association in your mind and make you less likely to want to be around that substance in the near future because you just associate it with sickness. Okay. Another approach that's very often used, especially for anxiety disorders, is systematic desensitization training, which is gradual exposure to the anxiety-producing stimulus and pairing that with relaxation techniques to extinguish the anxiety response. Okay, so for example, you might have someone who's deathly afraid of heights. Okay, so you might first, of course, talk about their fear extensively in the therapy sessions, and then eventually get them to be able to look at a tall building, not going in it yet, but just look at it, then eventually going in the building as these therapy sessions go by. So this is all very gradual. Eventually get on the elevator and go up to the top floor, eventually even walk to the edge and look out the window, okay? But all of that would be very gradual over time and would be paired with very well-supported relaxation techniques, okay? Basic breathing and just overall relaxation of the body and mind. And therefore, you can see the classic learning connections here. I mean, all learning approaches basically involve creating these associations, okay, between something good and what you want to happen, or something bad and what you don't want to happen, okay. On the last slide, we were talking about associating something bad with what you want to get rid of, okay, so basically it's a form of punishment. This is a form of reinforcement, of course, reinforcing the behavior of dealing with that fear by connecting it with relaxation and just getting people used to those stimuli. Okay, so if you have a fear of spiders, for example, the relaxation techniques are good, but in addition, you get to the point where you're able to look at the spider, maybe even hold the spider without, and you realize that I'm not, passing out, I'm not dying, it's not immediately biting me. These fears that I have really are irrational because I'm fine as I deal with this spider. Okay, so that's helpful as well. So a lot of these aspects of behavioral approaches involve operant conditioning, as I mentioned. So various schedules of reinforcement that I discussed in the learning topic, and token systems as well. Okay, so these tend to be very useful in combination with some of these other techniques, or by itself. Token system, very powerful. It's based on schedules of reinforcement. So the idea that you get it's not necessarily a gold star, but for adults that's probably not going to work very well. But some kind of a point system where the patient can keep track of things over time and give themselves a little bit of reward for avoiding certain things, or if it's alcohol or something, or for pursuing certain things like being willing to get on an elevator if you have that phobia, just being able to kind of reinforce themselves over time. Well, how are behavioral approaches evaluated? Well, they work very well for anxiety disorders, phobias, and compulsions. So OCD tends to, behavioral approach tends to work pretty well there. It's all about learning adaptive skills to replace maladaptive behaviors. It emphasizes only external behavior. Okay, there's no focus on internal thought processes, so it doesn't really address the root causes of the behaviors, but it just addresses the behaviors head on in a way that the behavioral approach addresses the symptom without addressing the underlying cause, and that's really where the cognitive or the cognitive behavioral approach comes into play, and that's what I'm going to discuss in the next segment.